Most women need some sort of surgery as part of their treatment for breast cancer. Now, the extent of surgery can vary depending on personal choices and tumor specifics. Sometimes we can just remove a small portion of the breast. Other times people elect to or need to remove the entire breast. Oftentimes with cancer treatment, lymph nodes need to be sampled as well to prove that it hasn't left the breast and it's locally contained. The purpose of surgery in the treatment of breast cancer is to control the tumor, get that out, as well as guide other recommendations for any other treatments that could be needed. Surgery is definitely part of one of the mainstay treatments of treating breast cancer. So typically breast cancer is diagnosed with a needle biopsy done by the radiologist. However, sometimes a surgical biopsy is needed to find out if a patient has cancer or not. If a patient does have cancer, there's typically two options for how to treat it. One is a lumpectomy, where you just remove the tumor, leaving the rest of the breast intact. The other is a mastectomy, where you remove the full breast. A mastectomy can be done where you save the skin and even the nipple in most situations, and we try to work with the plastic surgeon to rebuild the breast on the same day. We can offer different types of reconstruction with implants or even with tissue flaps, which uses the patient's own fatty tissue to rebuild the breast. We also offer flat aesthetic closures here at this facility for patients who choose to undergo no reconstruction in the traditional sense, but want to have a cosmetic outcome that's pleasing to them. Other times surgeries also include evaluation of the lymph nodes. Typically we sample only a few lymph nodes on the day of surgery to make sure that there's no cancer. If unfortunately there was cancer, sometimes we need to do more surgery called an axillary lymph node dissection. But in modern treatments, a lot of times we can get the patient out of the additional surgery with other treatments that we can offer. With mastectomies, we coordinate with a plastic surgeon to offer reconstruction on the same day. With lumpectomies, we offer reconstruction as needed for patients that desire it. We also sometimes coordinate with a plastic surgeon if the tumor is particularly large and it would leave a cosmetic defect. We can have him come the same day and rebuild the breast and reshape it to hide any potential defects or divots. There are situations where surgery is sufficient and the only treatment someone needs, or potentially offering a medicine that you take after surgery that blocks your estrogen to treat estrogen-driven tumors. Now, some women do need additional treatment with radiation therapy. For most women who pick a lumpectomy, radiation is part of the treatment plan and required for picking a lumpectomy. With a mastectomy, oftentimes you can get out of radiation, but there are certain scenarios where it's still indicated. For chemotherapy, this is typically based on tumor biology. You traditionally cannot pick a surgery to get out of chemotherapy. Chemotherapy is dictated by the tumor type that was formed. New tests have recently been developed that help guide recommendations about chemotherapy. They test the DNA of the tumor to see if it's something that would benefit from chemo based on historical controls. And with this information, that helps the medical oncologists guide whether chemotherapy is needed in addition to the other treatments such as surgery and radiation, or if those would be sufficient. Oftentimes we need more than just surgery to treat the breast cancer. If we had cured cancer with surgery, we would have cured it a number of years ago. So fortunately, we have some newer treatments in the modern age, and sometimes different treatment orders that are recommended versus what we used to recommend even 10 to 20 years ago. So most women assume surgery goes first, but there are certain scenarios and certain tumor biologies where actually we start with medications first. Some of the reasons we do that are to try to shrink the tumor so that it would make the surgery easier. Additionally, one of the main reasons sometimes we start with medication treatment before surgery is so that we can see the response of the tumor to the treatment. Based on how it responded, it can then guide us as to whether we should adjust the treatments, add additional treatments, or if we could even reduce the amount of treatments after that. So at Medical City Lewisville, I offer hidden scar surgery for my lumpectomies and mastectomy patients. I try to place the incision in a cosmetic location that tries to hide it either at the edge of the nipple or around the edge of the breast. And this will help improve the outcomes in patients' recovery and body image. Typically with the mastectomy, we were able to save the nipples in most situations. I work with a plastic surgeon who comes in on the same day while the patient is still asleep under anesthesia and puts in implants behind the skin to rebuild the breast. For the patients who choose lumpectomy, I offer oncoplastic reconstruction, either working with my plastic surgeon to do a more advanced reconstruction of the breast, but with a standard lumpectomy, I would adjust the tissue around locally and move it in to fill in the hole created by removing the tumor. And then this will help reconstruct the breast and reshape it into a natural breast shape. Thank you for your time, and I hope this helps you better understand the surgical management of breast cancer.